declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
That was WHO Director Tedros Adhanom Ghebreyesus escalating the worldwide alert on the nCoV outbreak. The WHO raised the alert level because of fears that the 2019 nCoV acute respiratory disease may reach countries with weak healthcare systems. The emergency tag means that nations must now step up their preparation and prevention against the spread of the virus. The declaration comes as the death toll from the 2019 nCoV climbs to 213 in China, with nearly 10,000 confirmed cases. Chinese health authorities said most of the deaths are recorded in Hubei province. That's the province at the center of the outbreak, of which Wuhan is the capital. China's Ministry of Foreign Affairs said it will send charter flights to bring home its citizens stranded abroad as soon as possible. The announcement came amid reports of many tourists from Wuhan being refused permission to board commercial flights. Meanwhile, 23 other countries have reported a total of 131 cases of the virus so far. The latest to confirm is the UK, which on Friday recorded 2 people. While fatalities have been limited to China, countries are amping up efforts to stop the spread of the virus. The U.S. has issued an alert level 4 travel advisory telling Americans not to travel to China because of the public health threat posed by the virus. The move came after the U.S. Center for Disease Control and Prevention confirmed the country's first case of person-to-person transmission. Other affected countries, such as South Korea, are evacuating their citizens from Ground Zero. 368 South Koreans arrived at quarantine centers on Friday, where they will be isolated for about 2 weeks. Philippine health officials have already traced the flight history of the 38-year-old Chinese woman who is the first nCoV case in the country. Greg Gregorio with the story.
The health department has recorded 2 more individuals as persons under investigation for possibly carrying the 2019 novel coronavirus acute respiratory disease, or 2019 nCoV ARD. 1 Chinese and 1 American have reportedly manifested flu-like symptoms. They also have a travel history to China. This brings the total number of PUIs to 31, including the 38-year-old Chinese woman who is the first 2019 nCoV ARD case in the country, as well as her companion. They are admitted at the San Lazaro Hospital together with another PUI.
The DOH is assuring the public that the first confirmed case is isolated and being properly treated.
The agency has already identified the flight history of the 38-year-old. She flew to Cebu from Hong Kong on January 21 via a Cebu Pacific flight. On January 22, she flew to Dumaguete via CebGo. And on January 25, she took a Philippine Airlines flight from Dumaguete to Manila, where she sought medical consultation after experiencing mild cough. The DOH has started its contact tracing for all the patient's fellow passengers under its Rule of 4, meaning the 4 people seated beside her, in front of her, as well as behind her would all have to be quarantined. The flight's crew members will also be informed. They will also locate those who might have had an encounter with the patient in all the hotels, restaurants, and resorts that she visited.
Ayaw natin na takutin yung mga contacts na magtago kasi hindi naman sila ikukulong. Importante na maintindihan ng mga contacts na dapat sila maobserbahan sa loob ng 14 days.
For now, the DOH is still waiting for the results of the sample sent to Australia to confirm whether or not the PUI who died of pneumonia last Wednesday was also infected with the 2019 nCoV. This process will now be shortened as the Research Institute for Tropical Medicine, or RITM, has developed their own nCoV primer or testing kit. For about a week, the results will now be available after a day or 2 with the new kits. For News 5, Greg Gregorio, we are One News.